For years, I suffered with lipedema. It affected so much more than just the cosmetic aspect. It affected my relationships, my job, my mobility.
It's not all about the aesthetics. It's about restoring quality of life. It's about relieving pain, and it's about restoring the patient's confidence.
It's not just about how I look, it's about how I feel.
We've treated over 3,000 lipedema patients from all over the world. They come from all over the United States, from Australia, from UK, Canada.
Lipedema surgery has given me a whole new lease on life.
Right now, I feel unstoppable.
My name is Dr. Sue, and this is ArtLipo Lipedema Surgery. Okay. Hello, everybody. Welcome to our live stream today. This is ArtLipo Lipedema Surgery, and I'm Dr. Thomas Sue. And I appreciate that a lot of you have already sent many questions for me to answer, and I'm going to try to cover as many as I can during our time today. So just to start off, some of you may know my background, and some of you may not. And I started off as an internal medicine doctor back in 1997. I did that for 8 years, and then I got into cosmetic surgery doing liposuction. So this is my 18th year of doing liposuction. And what I would say is very unique about my practice and what I do is that about 12 years ago, I started doing some very innovative things, such as circumferential high definition arm liposuction, doing it all the way around the arms. And that's something that nobody else had ever done before. And if you look around, doctors don't do that right now. And I've been promoting that type of complete sculptural liposuction for a long time, for those 12 years. And shortly after I started doing that, I got into doing liposuction circumferentially around the lower leg also, and knees. So for the last 10 to 12 years, I've really been specializing in arm and leg liposuction in a way that almost no doctors in the world have been doing, and doing very advanced work, which is very complete. And I was doing it for cosmetic purposes up until about 6 years ago when I learned what lipedema was. So my focus has actually become mostly lipedema in the last 6 years. And it just so happens that lipedema is a disease that perfectly matched with my skills of doing arms and legs. So I haven't done any other areas of the body for about 6 years now. It's all been arms and legs. So that's, kind of the story of, where I started doing lipedema and the expertise that I have in doing it. And at ArtLipo, I would say that the difference between what we do and what we represent compared to other doctors is that we really focus on making the legs look as good as they can, in addition to getting the lipedema treated as completely as possible. So I think we put extra focus on achieving a beautiful cosmetic, or the most beautiful cosmetic result that's possible. And I know there's a lot of doctors that are getting into treating lipedema. There haven't been many doctors until the last couple of years. And a lot of these doctors, they may be able to remove a fair amount of the fat where symptoms are improving a lot. However, not all doctors are able to achieve that high level of aesthetic outcome in conjunction. And in achieving the best cosmetic outcome, we also have to remove fat the most completely in areas, especially around the knees, around the ankles, and also in the arms. So the work that we do is not less complete. It's not the same completeness. It's actually more complete in fat removal than what most doctors treating lipedema do. So that's the ArtLipo difference. I'd like to get into some of the questions that our followers out there have sent to us. Are we ready? Okay. So I have a question from patient Stacy, or not patient, but follower Stacy. Who is an ideal candidate? Um, an ideal candidate for us is someone who is looking for lipedema relief. It could be cosmetic too, since we treat both. But for right now, we'll just talk about who's the ideal lipedema candidate. And if you've been learning about lipedema, you know that there's different stages of lipedema, from stage 1 to stage 3. Some people stage it up to stage 4. But at ArtLipo, we treat the earlier stages, stage 1, 2, and maybe some early stage 3 patients. And to give you maybe a ballpark of how to understand that, our patients are up to about 250. I've treated some patients who are close to 300 pounds, but it becomes very difficult for us and our technique to do the best job for a patient if they are above 250 pounds. And that's because those larger patients require a lot more fat to be removed. And at ArtLipo, we do everything awake. It's with local anesthetic. And in the state of Florida, where I practice, we are limited to removing 4 liters of fat in a single day of lipo treatment. What that equates to is someone who is up to 180, 190, maybe even 200. We can treat both the upper and lower leg in 2 treatments. And I like to be able to do that in my larger patients who are up to 250 or a little bit above. I often have to break that down into 3 treatments. And I've only had a couple of patients that I've had to break it into 4 treatments. And it becomes, I would say, it's more difficult for the patients to travel back and forth like that. It adds more healing time to everything. It adds more cost to everything too. So the larger patients who have a very large amount of fat to be removed, and sometimes those patients are a little bit older and their skin can sometimes be looser, and there's some other increased risks of doing large amounts of fat removal at one time. And when I say large amounts, I'm talking anywhere from 8 to 10 liters of fat. So those patients are better served by some of the other surgeons out there who would do the surgery under general anesthesia and admit a patient to a hospital. That way they can do a 10-liter removal and watch the patient for several days, because there's a lot more risk involved, bleeding. There's also skin concerns, other issues of the garmenting that become difficult. So there's a lot of things that make the surgery much more difficult for the surgeon, and somewhat riskier and difficult for the patients to recover. In my practice, we're limiting it to, like I said, the early stage 3 patient. One of the reasons for this also is, besides the number of surgeries and everything, is I like to be able to promise my patients a improvement in their cosmetic outcome. That's how I got into doing the surgery. I'm still at heart very passionate about improving your cosmetic outcome. When we have a late stage 3 patient who has very large amounts of fat with skin that's loose and maybe rolls of fat, and it's already wrinkly, I can't really promise patients a good cosmetic outcome. At that point, I think that liposuction becomes a surgery that is improving symptomatic relief and allowing patients to function better and feel better, not necessarily look better. And those patients may also need some skin removal afterwards, as far as a thigh lift, and also arm lift too. So some of the other surgeons that do these larger cases are more familiar, are able to do the tucks. I can't do the tucks. So it's better that you start off with one of the other surgeons that is skilled at treating the stage 3 patient. So let's get into, okay, so ideal candidate means someone who has lipedema and is a candidate who we can see some nice cosmetic improvement to. And that's most patients that are under 250 pounds. I've had patients even up until their early 70s that I've treated, and I have to take particular care because there is higher risk in these patients, and I may be breaking down those patients into 3 surgeries. Even when I could take more fat, I usually like to limit it to smaller areas to make sure that they're healing well. After our first treatment, then we stage it and make sure that they can recover easier from that. Other than that, the ideal candidate could be a very small patient too. I have patients that are 130 to 140 pounds, and most people say, well, why would they need lipedema surgery? Well, I have a lot of patients in that stage 1 category who, even though they don't look large, they're definitely not obese, they're just an average size patient. Some of them are pretty small, but those patients may have a fair amount of pain and tenderness and heaviness in their legs that is from the lipedema. So you don't have to have a lot of fat to have lipedema. And the staging system that we have is really inadequate because it stages people based on their size and not on their symptoms. And those two things don't always match. I have, like I said, a lot of patients, stage 1 and stage 2, who aren't very large, who have more symptoms than the larger patients that I have that you would call a stage 3, but actually their symptoms aren't as advanced. So this is a disease that you can't just categorize someone based on their size, or it's not the best way to categorize someone or to determine whether they're going to be a good candidate or not. The younger patients and earlier stage patients, their skin is much better, they heal better, and I have great results. My patients are, for the most part, very, very happy after the surgery with both the symptomatic relief as well as how they look. So let me see. The next question. What Karen asked, what techniques are you using? And what is Lipo 360? Well, I do all my patients' surgeries awake, and this is with local anesthetic only. And when I say awake, I don't give patients medications to zone them out, I don't give them anti-anxiety medications to make them sleepy or drowsy. And there's a particular reason why, because in the techniques that I've developed over many years, they are very specific. And it's what I call an interactive technique. Patients literally on the table will be tensing their muscles. And if it was the arm, if I'm working on an arm, I have them tense up their muscles so that I can feel all the muscles and I can control the fat in my hand and sculpt it much more accurately when I have a hard surface underneath. If everything is relaxed, I can't feel the muscle as easily, and we have to sculpt right down to the muscle. So it is a big benefit from a safety standpoint as well as an artistic standpoint to be able to feel where that fat layer starts and stops. So when I'm working on the legs, it's the same thing. The patients may have their legs outstretched, and I'll say, tighten it up. And throughout the surgery, I mean, I'm famous for this. I say, tight, 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 tight. And it's because the many areas on the legs are very fibrous. And when you're passing through that fibrous fat, the cannula wants to jag, and it wants to create the fat and skin to bunch up in the areas where you're not traveling smoothly through the fat. So if you're not traveling smoothly through the fat, you're getting irregular sculpting. You're not sculpting in a nice plane. So when patients tighten up their muscles for me, I can hold their skin and fat smoothly, and I can travel across it in a smooth fashion. This is a huge difference between what I do and what a doctor who's doing this under general anesthesia and has to work on a limp body. With limp and muscles are relaxed, and that skin is so gushy and mobile, and it's hard to hold it smooth. So huge benefit to doing things interactively. That's why I don't give things like Xanax or Ativan, which many doctors doing this awake, they say it's awake, but they give them all these medications, and then the patient becomes so drowsy they can't follow instructions. They're half asleep, and our patients are moving and turning and tensing their body. And just to give you an example, if a patient's laying face up, I can work on certain areas, but because this is a circumferential object, it's a cylinder. The leg is a cylinder. I've got to turn them this way, and then I've got to turn them all the way this way. I've got to bend their knees. I got to turn them on their side. I got to turn them upside, face down. And these are things that allow me to get around the cylinder and treat all areas and do it to the best of anyone's ability. Because if you can't get in the proper position, you're going to have a very difficult time sculpting in a effective and beautiful manner. So doctors who do this under general anesthesia oftentimes treat the front of the patient, and then they have them come back a second time and they turn the patient over into the backside. The limitation is because under general anesthesia, you have to be on a breathing tube. That tube goes in down through your mouth into your throat, and the anesthesiologist does not want your body moved in any position. If you twist or turn, the breathing tube can become kinked, and then the patient's compromised. So they do everything with you laying face up or laying face down, depending, on how they want to do it. And that really puts a limitation on the ability of the doctor. They have to then, as they're working around certain curved surfaces, they're doing this, they're going way down there and getting in very difficult positions. That makes the sculpting difficult. Whereas I can put my patient in any position, and then when they tighten up their body, they're holding themselves rigid, because if on a table, a body's just moving around and you're trying to get some resistance against her to get that fat out, you can't have that leg wobbling back and forth where it's hard to control. So the interactive technique that I've developed and been using for the last 18 years since I started doing liposuction is a huge benefit for any doctor to get the most accurate results. And so that's why we do it awake. And that kind of leads me right into another issue that patients always ask me about, is that, well, if you're awake, how do you keep a patient comfortable? Well, you have to expect that there's some discomfort during the surgery. And I've had literally, I don't know, in my career, maybe 15,000 patients, 12 to 15,000 patients. So I've been doing this awake technique for 18 years. And I can tell you that most everyone can tolerate this. There have been a tiny number of patients that have not been able to tolerate it. It's something that I always tell people, you need to be ready for some discomfort. And if you've kind of read any of the reviews or watched any of the videos, patients always say it's the numbing part, getting the legs numb with the local anesthetic, that's uncomfortable. And they don't like it. Why don't they like it? It's not because it's extremely painful. It's because it's very weird. Okay. So we have to numb up all these little spots where we make our incisions, and those are stingy. We call them bee stings. And that may be the most uncomfortable part of it, is the bee stings. And then after we have our incisions made, we go into the fat layer with something called a cannula. This is spraying the numbing fluid, which is in our IV bags. And that's the numbing agent we use in the IV bags it's salt water with some lidocaine in it. And the lidocaine is what does the numbing. So as we're going underneath in the fat layer underneath the skin with the cannula, it's just dispersing all this fluid. And by the time we're done, we have maybe 1 liter to 1.5 liters of numbing fluid in the leg, the plane of fat around the leg. And it's now swollen up and tight, and patients are now numb. And they tell, I know from doing this, so many years now, 18 years, that it's a weird, very weird sensation having it done. And in that process, I always tell people, you're going to feel some little stings here and there. And they're like, oh, okay, I felt one there, but we're moving. And they're like, oh my God, it's so weird, Dr. Sue. And that's the usual sentiment that I hear from patients. Now, that being said, as I've switched over to doing mostly lipedema patients, some lipedema patients have some extreme tenderness in their fat. So when we go through that fat layer with the cannula, these patients that have a very high level of tenderness in their fat, they'll tell me, Dr. Sue, that's sore. It really, that area is, kind of painful. And I go, yes, and that's usually not the entire leg. But certain areas around the shins, maybe on the inner knee, and those areas are a lot more tender on lipedema patients in general. So it's a very tolerable procedure. I know some people, it's like the unknown is very scary, but it's a very tolerable procedure. You can read hundreds of reviews, watch all my videos. I always ask patients how it was. It's the one leg done video. Okay, so they get up, and before they even get up, before they get to see anything, say, how was it? And they go, yeah, it wasn't as bad. It's not as bad as I thought, or it was stinging. I didn't like the numbing part, but the, actual removal wasn't too bad. So that is how 90% of the patients are. And certainly there's some people who are more anxious that I think have a more difficult time with this, but it's a few and far between. So let's see if I answered that question. That's the technique. Other than the numbing and how that goes, and how we use the interactive approach to have you tense and tighten your muscles. The instrumentation that we use a power cannula that has a vibrating cannula on it. Some doctors like to use water jet and other things. I think that's less popular now than it was even 5 years ago when I started getting into lipedema surgery. So you'll see that many doctors use different things. I think they're probably the majority use some type of vibrating power cannula now. So that's not any different than what other doctors do. Some people ask about lymphatic sparing. Lymphatic sparing is important from a standpoint that you don't use too aggressive a cannula. Also, when I first learned what lymphatic sparing meant by Dr. Joseph Stutz, he said you got to travel this way in particular and that way, and to avoid the lymphatics. I found that there's just some things that you can't follow exactly how he said, and so there's no well-defined technique of lymphatic sparing. In general, it means don't use the most aggressive cannulas, and water jet is not the only lymphatic sparing. So we use like I said, power cannulas are also considered lymphatic sparing too, if you are using the gentler ones and gentler technique. Let's see. Anna asked, how much fat can be removed, which we already mentioned, 4 liters in the state of Florida. There is no defined time period that the state of Florida says that you have to wait. So you could literally do another surgery the next day. We generally recommend a 2-month window between an upper leg and a lower leg. And that's so that the first area can heal and the patient can start recovering and feeling better before we get into an area that's just adjacent to it. However, I will do a secondary. If I've done a leg, I can have a patient who, if they were really rushed in time, come back in a couple of weeks to do their arms. There's no problem with that at all, other than they may still be having discomfort from the first area. Hopefully that answers the question about how long you have to wait in between the two. Michelle asks, Lauren asks, how long is the surgery and why? And apparently this person already knows that our surgery procedures are usually 3 to 4 hours, because the second part of the question was, why is it 3 to 4 hours compared to 1 to 2 hours with some other doctors? This question, I had to think about a little bit. I don't know what competitors or other doctors that they're referring to, because I don't know how long it takes specifically for other doctors to do this. So if I take twice as long as other doctors, or if you're asking why would one doctor take 4 hours, another doctor takes 2 hours? Well, is the doctor taking 4 hours a novice at this, that they just don't know what they're doing? Or is it because they actually do know what they're doing and they're taking more time to do it correctly? So I don't think, so definitely I do it the way that I do it, and I try to be as complete as possible. And I'm not trying to compare myself with anyone else as far as who's the fastest in doing this, but I think that you want someone who takes their time and does a proper job. I thought about it a little bit in another way. And some of the doctors in Germany, whenever a doctor does this under general anesthesia does carry a risk to the nervous system, to the brain, and other things. I mean, you never want to leave someone under general anesthesia for longer than you have to, because it can give them brain fog. It can even cause some other types of long-term injury to the nervous system. So 4 hours is getting into a longer surgery. Some patients, if they're under, heart surgery, something like that, may need a longer surgery than that. But I know, after talking to some of the doctors in Germany at the World Lipedema Congress, that they work in pairs. So because they're trying to get the patient out of general anesthesia as quickly as possible, if they do it in 2 hours, it's because they have two doctors, one doctor working on each leg, and then they can split, or half the time it takes. So that was one way that I thought, okay, you could do it that quickly, but otherwise I don't know how you could. Michelle asks, how do you maintain results? When can you resume normal activities? And what's the recovery like, or how can you get a better recovery? So maintaining the results. What comes to my mind is a question that I'm always asked, and it's like, well, is the fat going to come back? So I'm going to answer this in, kind of a general way. When you take fat out with liposuction, and I'm going to talk about liposuction in general, not just for lipedema, for all, tummies, waist, legs. And I've been doing this for 18 years. So this is from my personal experience, as well as what I've heard from, reading studies and everything else. When you remove fat very completely, and when I say very completely, I'm going to say 70 to 80%, maybe even 90% of the fat layer. So if you think about this, if this was the skin and this is the muscle and this is the layer of fat that's between the skin and the muscle, if you take it very completely, 70, 80%, now you have a very small little amount. That little amount is not going to expand very easily, if at all. Okay. And to have you understand why, when someone's gaining weight, they're not growing new fat cells. What's happening is the fat cells that are there expand. So this is a fat cell. And you're gaining weight, that fat cell can be blowing up. When you lose weight, fat cells in the area that we're utilizing will shrink. So we're not losing cells, we're not gaining cells. Our cells are expanding and contracting. However, when we do liposuction, I take out 80% of the fat in an area, which is atypical for me. The last remaining 20% would have a very hard time expanding in that area, in the particular area that we are treating. So if I'm treating your legs and I've taken out 80% of the fat, that last little bit of fat, 20%, is not going to be where your body wants to put it. In fact, if you have all your normal fat layer in your tummy and waist and on your buttocks and other places on your body, they have all the fat cells that were always there. And your body's most likely going to go to those places and expand in those places rather than the area that we treat. So this is true, that lipo is very lasting when you do it completely like I do. Not all doctors treat things very completely. In fact, I know this for a fact also from seeing many patients who've approached me for redos. Patients who go to a doctor and they don't remove very much, they only remove 30% to 50% of the fat. And they take a fat layer like this and they come down like this. They leave a lot behind. It may look good cosmetically for short term. However, if that patient gains weight in the future, that area can expand fairly easily. So there is a big difference in the long lasting nature of lipo, or whether it's not as lasting, depending on how complete that lipo was done to begin with. And if you can't really go to a surgeon and say, well, what percentage of fat do you remove? I mean, you could ask me and I'll tell you that, but for most surgeons, they're not going to tell you, I'll only take out 50%, I'll only take out 30%. They're not going to tell you that. The way that you, as a potential patient or a customer, is going to be able to tell is by looking at that doctor's results. And if you can say, oh, wow, that's a big difference, that doctor really makes a big difference in their before and afters, that's when you know that they're doing things very completely. And if you look at it before and after, you go, well, that patient still looks like they have a lot of fat in that area. It doesn't look very complete. Then you're probably correct in that manner too. So maintaining your results is important. And I always tell patients, if you're fluctuating like everybody does in their weight, 5 to 10 pounds a year, that's a normal fluctuation. And you're probably going to have very lasting results. If you are in a trend where you're gaining weight and it's not controlled, you're going up 20 pounds this year, 30 pounds last year, that kind of weight gain is definitely going to show on your body somewhere. And it's probably going to collect in areas where your body collects it the easiest, such as the tummy and the upper thighs, but it could also go back into some of the areas that have been treated with lipo. Let's see, next question. Let's see. So let's see. Hi, Dr. Sue. This is from Ivanina. Hi, Dr. Sue. How do you do lipo on calves on slim patients with only small pockets of fat? Well, as I mentioned earlier, I have quite a few patients who are stage 1, and I have some very tiny patients that even I sometimes have to look at their pictures and really scrutinize and go, wow, is there some fat there? I do have those patients too that have just a very small amount. But if you're a very thin patient, 120 pounds, you already have very slim or thin legs. It's not about having a lot. It's about having a small amount of fat in the wrong place. So if you have half a pound of fat or just like it's hard to say the amount, but if you have a small amount of fat that's collected around your ankles or collected around your knees, cosmetically that can really ruin the appearance of someone who's very slim, because it covers up the inner contours that near the ankles that really make a leg look nice and beautiful. So it's difficult to do on a very slim patient, but you need someone who's skilled like myself, because if you're tackling very small areas, unless you get those areas very complete and also have very smooth technique, then it's not going to be much of a change, or the change could be lumpy and bumpy and unsatisfying. So yeah, thin patients, absolutely. You can send your pictures to us and we'll give you our estimate on how to do that. And I'll talk about our consult process in a little bit. See, next patient, Feral Forever. Does your office work to get lipedema covered through insurance or strictly private pay? And this is a great question, because insurance is such an important issue for many patients these days. And although insurance companies are starting to cover things, that doesn't mean that everyone's going to get covered, even if you have insurance that says that they will cover it. And going back 2 years ago, I'd say that very few of our patients got coverage on insurance. But things are changing rapidly. And as of the end of last year, there were two major lawsuits. I think it was Aetna and United. I may be wrong about that, so don't quote me. But two of the major insurance companies lost class action suits because they were not paying for the surgery and claiming that the liposuction surgery for lipedema was an experimental treatment. And both of them lost. And that is a major milestone for us in getting patients covered. So that's great news. But I'm going to tell you my real life experience. We hired a nurse practitioner and also an insurance specialist earlier part of 2024, and it's about 5 months ago. And we were doing everything that we could to help patients, along with this process. So I think a major misunderstanding of patients, because they're not as familiar with insurance and what it means and how it works, is that when you go to your typical doctor and you get treatment, whether it's surgical or non-surgical, and that doctor is is a participating member of your insurance, your treatment is pretty much covered other than your copay. And then the doctor who treated you has to submit for insurance reimbursement on their end. And they're participating, they're accepting insurance. Well, we don't accept insurance at ArtLipo. And there are some doctors that accept insurance out there, but right now the insurances are reimbursing so low, and not just so low, but they're also reimbursing so inconsistently that I can't take insurance. And I have chosen not to participate. Many doctors, not many, but some of the doctors I know who have participated with insurance have been reimbursed crazy rates like $600 or something that doesn't even cover their cost. So what we're talking about right now, as far as my practice and that I don't accept insurance, is that our patients have to go through the process of applying for insurance either prior to doing surgery, or we've had patients that said, well, I'm not planning on getting insurance, but then they go through our surgery and they say, you know what, I'm going to see if insurance will cover some of, this retroactively. So when you go to a doctor or a clinic like ours that does not accept insurance, you have to get your best bet is to get pre-approval before. That's like getting approval from the insurance company before you do the surgery. And I'm going to tell you right now that even if your insurance company says that they cover lipedema, even if they give you a pre-approval, our experience is that many of the patients are still not getting reimbursed. And this is how it happens. They say, okay, you're pre-approved, but in the fine print, there's something that says there still will be a review process after the surgery before any payment is approved. So our patients get we were getting approximately 40% of our patients pre-approved. 40%. Okay, so that's still a fairly small number compared to 40 out of 100. The other 60 got denied. Okay, so and we'll talk about that in a second. But even the ones that got pre-approved go through the surgery and then send in all the surgical documents and everything that we can. The insurance companies are still coming up with different reasons why it's not approved. You didn't send this, you didn't send that, or going back and actually even saying that the patient wasn't qualified for some reason for the surgery. This is all a game, okay? It's all a game that the insurance companies play to try to deny everything they can. And in some cases, they win. So even in the patients that get pre-approved, I would say it's a fight. And we have had a number of patients that have had to fight for another year after the surgery to get payment. The other thing that I can tell you is that's shocking to me, but I've seen it so many times. It's not a surprise anymore. I have some patients that are only sent a $500 check after everything's said and done. And then they're coming back to me and saying, well, what do I do now? Well, it's incredible. It's crazy to, to get payment for $500 on a $20,000 surgery. It doesn't even cover the cost of disposable things that we have in our surgery. So it becomes a fight, and some patients have to hire a lawyer and go through this long protracted thing, and some of them end up getting paid and some of them don't. So let's wrap it all up. If you're going to go for this surgery, we will help you. We will help you even in submitting all the documentation. But we had recently had a number of patients on different groups out there complaining about the personnel that we had hired to help them in this process. We're doing everything we can, and our insurance specialist is spending all this time talking with the different insurance companies. But at the end of the day, it comes down to it's a patient responsibility. When our office does not accept insurance, it becomes the patient's responsibility to carry it through. We can do everything we can, but a lot of patients were getting upset that they weren't getting an insurance check. And that is just the reality. And if you're one of those patients that says, I can't afford to do this without insurance paying for it, then you have to get pre-approval, number one. And also know that no matter what, even with all the care and effort that we can put into it, and also stepping in outside of our office and hiring a lawyer, that you still may not get any kind of payment back. And that's the reality. So if you truly can't afford this, don't do it. Or seek out one of the offices and doctors. There's some doctors out there that do accept insurance on certain insurance plans. And if they do, they're accepting a lot lower rate in general. And that's what you'll have to seek out somebody else. And I know that a lot of them have very long waiting lists because there's just not enough doctors that are willing to accept insurance in this area of lipedema surgery. So sorry for the bad news about that, but that's kind of how it is right now. We'll help you as much as we can, and we still have an insurance specialist that's going to continue to send paperwork in and give everything that we can from our office, and even do peer-to-peer reviews and other things like that. Okay, so I'm going to move on to the next question. What's the downtime? Downtime's it's a multi answer. So you're going to be in a lot of pain and tenderness for the first few days. So you're going to be moving around slowly after the surgery. Then you're going to be into a phase of severe swelling, and that's going to reach a maximum about 2 weeks out. While you're severely swollen, you may feel like you just have to move slowly. Everything's going to be very stiff. It can be dull achiness, and that goes up quickly, reaches its maximum at 2 weeks, but then it's going to take anywhere from 3 to 6 months for all the swelling to go away. So I have some patients, the worst case patients I have call me at about 6 weeks out, and they're still very swollen. And they're saying, Dr. Sue, when is this swelling going to go away? It's just horrible. And I just tell them you're going to turn the corner at some point, and it will. But some people last longer like that. I would say the average patient somewhere 3 to 4 weeks out is already seeing that swelling start to come down significantly, and they're feeling better and better. But it is a slow process for some people. When I say 3 to 6 months, it's also it's not like you're going to have a tremendous amount of swelling at 3 months. By 3 months out, you'll already have at least a 50% reduction in your swelling. Probably more than that. It's already going to be looking pretty good, but some of the areas are still going to have a little thickness and feeling rubbery, and that's what swelling means. Okay, so when it's completely softened again and all the skin is nice, that's about 6 months out for most people. And we tell patients don't get into any significant exercise, for the first month because it can drive up inflammation. So for the first month, you're going to take it easy. And actually, some people go, well, when can I take a bath, or when can I get in the pool? That's usually around 2 weeks. Okay. So another question from Razane Baba. Okay. What are some things we can do for pain control before lipo? Unfortunately, there's not really anything that I can tell you that is going to help your pain that you can do prior. I just say the most important thing is understand that this is a surgery and it's not super painful, but it's not painless either. If someone says, is this a painless surgery? I'm never going to tell them that. There's discomfort in it. And you should understand that. So trying to get it to a point that you prepare yourself mentally for some discomfort is the best thing to do. Okay. Next question here. How does daily swelling improve? Okay. After they're gone. Okay. I think we've already answered that. Another question concerning manual lymphatic drainage, or MLD. One patient's asking, why don't you suggest starting the day after surgery? So there are doctors and there's therapists that do MLD that recommend starting the day after. Understanding MLD is about getting rid of swelling as quickly as possible. Some will say it's about preventing fibrosis, and I don't believe that that's the main reason. In fact, I don't think that's important. I think MLD is the most useful thing for getting rid of swelling as quickly as possible. So we usually recommend about 1 week out. If you start MLD or any kind of massage too early, I think it could potentially loosen skin, that you want that skin to stick down. And anyone who is, if it's an MLD specialist, that a person who is not as experienced, they may be actually doing some rubbing, which could actually separate the skin. I've seen that a couple of times. So I'm very wary about having it started too early when there's not really a strong reason to start it early. Another patient's asking, are antibiotics absolutely necessary? And I would say, no, they're not absolutely necessary. It's a personal choice. It does help prevent infection, but some people are against taking antibiotics, and that's okay. Another important question is the incisions. This patient says, the holes, do they leave bad scars? Well, the incision sites generally heal very well and are very small, but there are many of them. I would say that there is a concern from a cosmetic standpoint for mainly patients with darker skin types that know that their skin heals in a way where there's a darker area or darker line. The patients who are light-skinned Caucasians, they heal so well. You can see some little marks, I would say, for the first 6 to 12 months, but then thereafter, they're so hard to see, especially if you were standing next to someone. You probably wouldn't be able to see them even if you're 3 to 5 feet away. But some patients who are prone to hyperpigmentation can certainly have darker spots, and they're not raised scars in general. They're just darker hyperpigmented spots. So I think our time is running out, and I'd just like to go over a couple things. So if this is something that you're interested in doing and you'd like to find out some more information, the way to contact us is get on our website, and there is I think it's a bright orange tab on the first page, and it's for a virtual consultation. And you can reach out and talk to our consultants and ask some questions. But if you're ready, you know that you're ready to have an evaluation, our virtual consultation is something that is, I would say, more unique than what most doctors do, because we actually ask you to send us photos of the areas that you want us to treat, whether it's your arms or legs. And in that page, it'll show you different poses to take the pictures. So what we do is we'll take your photos, and on the areas that you're requesting a consultation for, myself or one of my assistants will draw the outlines of where the end result would be. And then it's kind of colored in so that you can see, you can get a visual idea of what your new shape will be. And we're pretty accurate on our assessments. And I can do this. I've developed like a sixth sense, or like uh, my X-ray vision, and I can see, what the muscle structure and bone structure looks like. And because of my art background, I didn't say this before, but my background is as an art major. That's what I got a degree in fine art. So it carries over into everything that we do. So we draw on these photos, and you get to see that. If there's any issues that I would be concerned about, warning you, negative things like skin looseness, we'll draw where wrinkles and skin looseness would be and indicate if it's going to be a mild issue, or if you're going to have more moderate and severe wrinkling that may require some type of skin tuck afterwards. So we'll give you the good and bad in our assessment. But go to our website. It's artlipo.com. It's the name, artlipo.com, and you can find all the information on how to contact us. So thank you for joining us. I hope this was helpful, and I look forward to doing more if this is something that you'd like to do. Transforming lives, one step at a time.